This is breaking news from News 8.
Good afternoon. We start with breaking news: overcrowding in local emergency rooms and what's being done to address it. Today, one local hospital system saying it will put up a new structure outside the ER to expand its care options. Erica Cost is following this and is live in the newsroom with more. Erica.
Well, good afternoon, Mark. It's an issue hospitals across our region have been facing. Rochester Regional Health says the overcapacity has worsened over the past few weeks, and if you are not in a life or death situation, you're going to be experiencing these delays. He says internally what they're doing to help mitigate building that external structure you mentioned, he says, will significantly help reduce wait times and expand care. Prior to the pandemic, patients would normally wait around 30 minutes for care. That has climbed up to 40 minutes here at Rochester Regional. In terms of beds, they have 66 beds in the adult ED and 12 in the pediatric ED. Together, that's 78, but right now, Graham says they're seeing a census climbing over 150, 160 mark. He says he wanted to make it very clear those with urgent, life-threatening conditions are not the ones experiencing major delays.
High acuity patients that need a kind of an intensive care unit or surgery or those kind of immediate interventions, I think you can expect those to run fairly normally to what we saw even pre-pandemic, essentially. So I think the folks that are waiting for a hospital bed for what we consider a little bit more kind of a standard medical admission, those are the folks that are probably experiencing the majority of the extended waits.
Graham says they have been in communication with the governor's office as she has offered several options on how to help mitigate the crisis. Much more on that part later tonight here on News 8. In the newsroom, Erica Cost, News 8.
Watching this closely, Erica, thank you. According to the state health department, there are currently 232 people in the Finger Lakes region with COVID who are hospitalized, including 54 people in the ICU.